This segment of DelmarvaLife is brought to you by Peninsula Home Care.
Nurses make a difference. Anytime, anywhere, always. That's the theme of Nurses Week 2023 happening this week. It's a week to honor the unwavering commitment of nurses to their patients.
Nurses like the ones with Peninsula Home Care. And joining us in Historic Studio D this afternoon are Holly Jones, Community Liaison with Peninsula Home Care, and Michelle Chakra. She is a Clinical Manager of Performance Improvement for PHC. Ladies, thank you so much for being here. Nurses, wow, your Peninsula Home Care would not even exist if it weren't for nurses, would it?
No, and you know, we feel so grateful to be here to really talk about our nurses team, because without them, it would be impossible really for us to do the skilled care that our patients need for them. Our nurses are really the eyes and the ears for our providers. Our nurses have this intimate experience with their patients and their family members, because they're there every day with them. You know, sometimes a few times a week, or depending on what their needs are, you know, whether it's a wound or post surgery that they had for like a joint or something like that. They're helping take care of our community.
Sure.
And tell us about the kind of clinicians needed for home health care, because they really need to be able to cover several specialties, don't they?
They do. Other than nursing, we have physical therapy, occupational therapy, speech therapy, medical social work, and a home health aide. So it does take, like they say, a village to take care of some things. So they takes a lot of people to do this. And specialties, we do have a wound care specialist. And when you're in the home, there's so many things that take place. Have to think outside of the box and be the specialist of everything, whether it's respiratory, gastro, a joint, a wound, any type of illness, infection. You have to really be on point and to be able to see and recognize the different things that take place in a home.
And a big part of their job, of course, is patient education, isn't it?
Absolutely. The more that people are educated and can take care of themselves, the less risk of having an exasperation of anything, especially CHF. With our CHF program that we've introduced, it's an educational portion, providing equipment if the patients don't have it, like a scale, pulse ox, blood pressure cuff, diabetes education, all the major ones that put people back into the hospital. That education is a key component to keeping them out. With the CHF program that we introduced a few months ago, patients are staying out of the home. Patient care calls were made. They're still using the equipment. They have not had to go back to the hospital. So education is highly important.
And when you say CHF, you mean congestive heart failure?
Yes, I do.
Yes. Healthcare is this ever-evolving field with all this new technology that's always coming out. How do the clinicians keep up with the latest developments?
Sure. So we quite regularly have education in-house, so we'll bring the entire team in. We have all staff meetings every month, and we really are currently working on bringing in different community partners to really educate the team on how they can continue to improve because of all of that new technology.
I imagine working in home health care is rewarding. Do you guys have any personal stories you can share?
I have a great one. I had a patient who I went to see the first time, and she was not very receptive to me being in her home. Politely asked me to leave. I didn't. I could feel that she really wanted somebody but wasn't ready to face. And week after week, I kept going back. And when I left, the improvement in her overall health, she lost weight, checked on her diabetes, weighed herself daily because she had her congestive heart failure. She hugged me, gave me a kiss on my cheek, and was sorry I was leaving. That I tell everybody that story because week after week she'd just tell me to leave, which is fine. But I was persistent because I could tell that for her she really wanted the help, because she would let me stay, obviously. And it was great. For me, that is the best one. Her outcomes were amazing.
Yeah.
The outcome is what put you there.
Yeah, yeah. Well, thank you so much
thank
for
you.
being here, Holly and Michelle
Thank
with
you.
Peninsula Home Care, and thank you for all you do.
Yep, thank you guys.
Thank you.
Thank you. Thank our nurses.
Yes,
Yes, all of them.
absolutely.